President Trump has been giving daily briefings, and the Connecticut congressional delegation has been working to get aid here to our state. And with us now from Vernon is Congressman Joe Courtney. And Congressman Courtney, thank you so much for joining us this morning.
Morning, Dennis.
First of all, what is the very latest in terms of help for Connecticut coming from Washington? What do you know?
So 2 emergency coronavirus appropriation measures were enacted, first on March 6th. Second was last Thursday that was signed into law. Included in the second, the first coronavirus supplemental appropriations bill was an increase in federal funding to the states through the Medicaid program, which in Connecticut means $440 million new dollars that are going to be coming into the healthcare system, so that the efforts that we just heard about from Hartford Hospital will get a surge of money. We also appropriated money to the CDC to help purchase some of the equipment that the most issue right now. And lastly, the law that was signed into law on Thursday included an immunization and indemnification program so that hospitals like Hartford Hospital can use the N95 masks that were assembled for construction work. And that's why those firms now can donate those products and again, boost the supply. There's more to be done. The first delivery came to Connecticut from the stockpile at the Department of Health and Human Services. It was a fraction of Governor Lamont's request. We're pushing to get more of that equipment through. And then starting tomorrow, there's going to be movement on a third bill, which is going to be a massive bill, which I'm sure you've been reading about in news reports, which again will provide a whole variety of new help, including unemployment compensation assistance for Connecticut. Again, I've been talking to the Commissioner of Labor, Kurt Westby, who, again, they've been flooded with claims over the last week or so. And it's critical that programs like that get more help from Washington.
I should point out, I neglected to do so at the top of the program, all of our guests are joining us remotely because we are practicing safe distancing here at WFSB as well. Normally our guests come in for Face the State, but you're joining us from your home today, and we appreciate that. Let's talk a little bit about your district in terms of the 2nd Congressional District. As you walk around and you talk to people, what are you learning about the effect of the coronavirus there?
So first of all, just like Mr. Black said, the turnout and the participation has been extraordinary. We had school districts that stood up the grab-and-go school lunch availability for nutrition for kids while the schools are closed. I was at the Vernon Middle School a couple days ago, where again it was one of the first communities, and they set up a system really very efficient and effective, and the school staff has just pitched right in. We've been, definitely talking to the hospital systems. Again, Bacchus Hospital set up a drive-through testing center that are up there. Manchester Hospital, which will help serve the North Central region. Same thing. L&M Hospital down in New London. So again, the first responders, the healthcare workforce, school systems have really, again, just risen to the challenge. It's quite impressive, and that's what some of these supplemental appropriations are aimed at, in terms of more funding for nutrition programs, senior citizens who normally get meals at senior centers because they're closed. That's also another critical area. And again, we've had volunteers showing up to do home delivery, Meals on Wheels type of model. So it is quite impressive. The number of cases are somewhat low in Eastern Connecticut. Again, there was a case reported in Norwich yesterday, East Lyme, Enfield, and they're starting to pop up. And we know we've just got to be really disciplined about the social distancing, and again, get the resources out there so that the people who are doing great work get all the help they
Congressman, in terms of some of the factories in your district, I know that all across the country there are some companies that are sort of in wartime mode, and they're shifting production from what they normally make to items that are needed right now, like masks and ventilators, things like that. In your judgment, from your knowledge, are there any companies in your district that could do that fairly easily?
So we've actually, done an inventory, and it's American Woolen up in Stafford, which is a textile manufacturer. We've checked with them, and because they do woven products, it's not a great fit. I mean, to be honest with you, I was very happy that President Trump signed the Defense Production Act order that would, again, give the government authority to direct production into critical needs. Unfortunately, they have not really followed through in terms of actual, implementation of that order, which is just a complete mystery to me, because I think that there really is, a willingness for companies who, again, are doing it on a voluntary basis. But this issue of equipment is issue number 1, 2, and 3, as far as I'm concerned. And the Defense Production Act was put into place for precisely that reason. This package that we're about to probably vote on in the next couple of days or so, I know Senator Schumer is adamant that there's going to be language in there to force the issue of implementation so that we get, again, America's industrial base better engaged.
Congressman, there's talk about cash payments to all Americans to help get through this crisis. And I got a comment from a landlord who said, we're kind of struggling to pay the bills. We have mortgages on our buildings and things like that. They're concerned that perhaps these checks will be given to people and it might go to other items besides their bills as well. Is there any relief at all for people in their situation?
So again, the calls we're getting from people in various sectors are, extremely widespread because the impact of the economic impact is so widespread. I think getting, cash resources out to people, whether it's in the form of straight cash payments or whether it's about expanding the unemployment compensation system, I think will provide room so that, basic necessities like rent are covered. Again, this is... time is of the essence. We got to get this assistance out there. And again, I think we can help people like landlords find ways so that they, again, are protected during this, incredible dislocation that we're going through.
You don't have a crystal ball any more than I do, but I'm going to ask you this in terms of just a gut feeling you have. When do you think that we'll start to see some return to normalcy with some shops opening up and, some of these things that are going to be closed, maybe schools back in session?
So, ultimately, that's a public health question, and I really feel like we've got to, follow their guidance. What I would say, it's encouraging that both sides are coming together to get support out there as quickly as possible, and we're going to see action in a few days.
Congressman, one last quick question for you, and I apologize to our viewers because some of these Skype shots are not exactly the most pleasant to watch. They're kind of moving, and you get a little bit nauseous watching them. But you're doing a good job nonetheless. One of your first times doing this. I want to ask you, in terms of the recovery and the rebuilding of the economy that will happen after this, as you look across the 2nd District, there's been so much reliance on products made in China, particularly medicines, and everyone's getting a wake-up call now that maybe we should make them in the United States. Is there any place in your district that you think could start up making these things so that we don't have to be relying on a foreign country for all these essential items?
So medical device manufacturers are very, not just in Eastern Connecticut, but Connecticut as a whole. But there's no question that, when the dust settles here, we have got to really look at critical infrastructure in terms of making sure that we're not exposed like this. We do it in the defense sector. Our submarine construction, is almost completely made in America. We've got to start looking, frankly, at our healthcare infrastructure, public safety infrastructure, to make sure that we're not as vulnerable as, I think events have exposed over the last few days.
Certainly has. All right. We appreciate you joining us today, Congressman Joe Courtney. Best of luck here and in Washington. Thank you.
Thanks, Dennis.
In a moment, Hartford Mayor Luke Bronin, and I welcome your comments right now on social media. You can find me on Twitter, Instagram, and Facebook.